Hello, I'm Lance Jones. I'm the Market President for LewisGale Regional Health System, and I wanted to take this opportunity today, joined by our Chief of Surgery, Dr. Byron Gross, to talk a little about our process as we look to now resume elective surgeries. Over the last couple of months, LewisGale has been very focused on taking care of folks that have been stricken by this pandemic. We have instituted a number of particular safety precautions and additional measures that have exceeded the CDC guidelines in regards to ensuring the safety and quality for all patients that have been at our hospitals, and certainly all healthcare workers that are in the front line. Today, what we plan to share with you are some of those that are implemented to allow you to feel very confident in the hands of your surgeon to return to your hospital and to make sure that you are indeed able to have that surgery done that you had previously scheduled with him or her. Dr. Gross, thanks for joining me.
Our surgical leadership team has worked diligently over the last several weeks on every step of the process to get a patient safely through an operation. Whether this comes down to preoperative screening, preoperative COVID testing, the actual surgery, and the postoperative care. All of our surgical patients undergo a rigorous screening process, whether that be in person or over the phone. We then offer preoperative COVID testing for patients. Those results will be back within 24 to 48 hours. And while waiting for those results, we ask that patients stay in self-quarantine. We also limit the number of visitors that can come into the hospital with our surgical patients. We're only allowing one visitor to accompany our surgical patients, one visitor with our birthing mothers, and then there's certain other extenuating circumstances where visitors are allowed. We also closely monitor entry into the facility. There will be one entrance to the hospital for all of our surgical patients, where they'll undergo screening and temperature checks.
We've implemented also a number of additional steps in the operating room, and while we've always been very, very diligent in regards to our cleaning, sterilization processes, some of these other steps in the operating room continue to make sure that we're doing absolutely the right thing. At the end of the day, when you are finally in the operating room, you're asleep, and you trust that your life is in our hands to do everything that we can, and we will ensure that our focus remains where it should be, right with you.
Safety is always number one in the operating room. We have many processes in place to maintain sterility within the operating room and assure that they stay clean. The coronavirus pandemic has highlighted some of those processes though. Teams adhere to strict masking requirements and wearing appropriate personal protective equipment. Our operating rooms are cleaned by trained professionals between every case, at the beginning of the day, and at the end of every day. And all of this is to keep us as sterile and clean as possible.
Dr. Gross spoke of the efforts around your entry and arrival to the facility, our masking process, our temperature screenings, our questions in regards to maybe where you've had travel, fever, shortness of breath, cough, etc. Once you arrive into the facility, you'll notice that our waiting rooms are now rearranged and there's an appropriate distance between chairs. We also ask that you don't bring any food or beverages with you during your time here. Our environmental services team are very, very focused on our public waiting areas and actually do a number of checking initiatives throughout the period of a day, looking at certain services where we know that this virus can certainly continue to live. Above all else, we're committed to the care and improvement of human life, and your life is one of those. So you have the utmost commitment on behalf of LewisGale to make sure we're doing everything that we can to make sure your surgical experience is both a good one and a safe one without doubt.